Welcome to Medcast. Here we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. My name is Dr. Wafaa Faysal. I am a consultant pediatrician in Dubai. And my guest for today is Mrs. Magda Snowden. Mrs. Magda is a former nurse executive turned mental agility expert. Mrs. Magda Snowden primarily works with healthcare professionals in the areas of stress and burnout prevention, well-being strategies, and mentally agile leadership. Welcome, Magda, to the Medcast podcast. It's a big honor to have you with us today.
Thank you, Dr. Wafaa. Thank you for having me here. Good afternoon and happy Friday.
Thank you very much. It's a big pleasure to have you, and the episode I think will be very, very interesting because today we are speaking about mental health, specifically for healthcare providers and healthcare professionals. So now in the era of mental health awareness, healthcare professionals are, I think, they are a very deserving audience for mental health care, if I can say. Tell us more about what you do.
Okay, so thank you for the introduction. So I am a former nurse executive and I have worked in both public and private healthcare systems in the UK, Kuwait and Dubai. I am now a mental agility expert, team transformation coach and mental health first aider. And my passion actually lies in empowering healthcare professionals with human skills. And when I talk about human skills, I refer specifically to mental agility, emotional intelligence, empathy. All the skills that help us be better humans, because we are all humans dealing with other humans.
True. And you know, this profession, I can tell you that healthcare in general, whoever works in healthcare know that this profession is about giving. I was discussing with you before outside. So it's all about giving. I mean, these people should give to the patients who are usually in their most difficult moments. They come to us in their difficult moments, and we should support them, whether it is by providing them the treatments and even psychologically. So it's all about giving. And where is the balance here? From where the healthcare professionals receive, let's say?
Beautiful question, and actually this is something that I can talk about 24/7. We come to this profession because we want to help others,
yes.
Right? Whether we are in a clinical role, even non-clinical role, anyone who works in the healthcare facility. So if we want to continuously give, we need to start thinking, how do we replenish our own batteries? How do we refill our own cup? Or how do we make sure that our candle is always lit?
Yes.
So like Florence Nightingale, if you remember in the old days, she used to walk around the hospital unit with a candle lit in her hand. So she was the light for the patients. So imagine that ourselves as a healthcare professionals, we are the healers. This is our light. We need to make sure that this candle is always burning.
Exactly.
So we can continue being the light for others.
True. But there is a balance in life between giving and receiving. They all tell you that this balance should always be there. However, I mean, there is a rewarding part of that job. We don't have to underestimate this. So as a doctor, if my patients are getting better, if the children are smiling again, if they are healed of their illness, this is a big reward from life, from the universe, from God. So, but on the other hand, of course, like we are sometimes, stuck in situations where we don't have enough sleep. We we are not able maybe to eat on time, to visit the toilet on time. So sometimes, like as we are human beings, how we are people like you are able to support these healthcare professionals. I don't mean only doctors. We have doctors, we have nurses, we have all the technicians, all the assistant nurses, everyone who deals with the healthcare sector. Who is there to support them in difficult times when they are really stressed, when they are about to be burned out? So how can you, professionals like you, help them?
Thank you again. This is $1 million question.
Yes.
And through my journey in healthcare in 3 different countries and 2 continents, I have realized that we all face very similar issues on individual level and organizational levels. I would say for me, it was not stress or burnout, it was frustration. I was frustrated that we are facing these issues and no one is able to put a solution on the table or even start a discussion. It became very obvious, and this is now supported by research. Organizations like World Economic Forum or Thinkers 50 have highlighted that there is a big gap between strategic acumen and human skills. So we are lacking the exact skills to navigate stress, because stress is always going to be there. It's a naturally occurring phenomenon. And also how to prevent burnout. So for me, one of the critical points of discussion in here is the hero narrative. In healthcare, historically, we are called heroes.
Especially in COVID.
Especially in
Yes,
COVID.
we
And if you
became the real
remember,
heroes.
yes, in the UK, the whole nation was coming on the streets in the evening clapping.
Yes,
for
even
the
in
healthcare
Dubai,
heroes.
every
Even in
night
Dubai.
the people were going out to the balconies and
Yes.
clapping for
Clapping
the
or
heroes
lighting the
at a
candle.
certain time. I can
Exactly.
say 8 p.m. or something.
Exactly.
Yes.
But there is a challenge with the hero narrative. Heroes don't ask for help. When we continuously keep calling healthcare professional heroes, and we expect them to be available 24/7 to always give and hardly receive, then these heroes at some point are gonna go for stress, and this stress might turn into burnout. So we don't want to go into that narrative and start glorifying recovering from burnout. We want to equip healthcare professionals with skills so they can navigate the stressors. They can navigate the daily difficulties that we are facing in the workplaces. They're always going to be there.
Yes.
But the way we look at them, let's look at them as challenges, not as problems that will keep us stuck in the situation.
Yes, great. Very well said. So in this mental agility framework that you do, there are certain steps that you follow. Can you tell us more about it in details?
So the framework that I have developed has 5 steps. I make sure that before I even go for coaching training with specific individual leader in our organization or team, healthcare team, we establish the baseline. So we cannot coach if there is a real knowledge gap, something that people don't know. And this is what became apparent to me when I was doing a lot of team transformation interventions with senior nurses in one hospital in Kuwait, that when the nurses found out what is stress, how does it work, what are their triggers, why we label people, why we judge people, why we get stressed at work, they were much more successful in accepting the coaching and making a change for the better. So my magic formula here is awareness, choice, change. With the awareness, we can make a better choice and we can produce a positive change. So there is a lot of science and a lot of definitions that we need to go through in this framework before we start putting interventions such as coaching, mentoring, training. One of the further steps also explains the ROI or the VOI. Executives in organizations, they want to know what is in it for me. How are you gonna prove to me that the money that I am investing are gonna produce the desired results? So I also talk about value. It's not only money, but the actual value. So if your employees are gonna be less stressed, they are able to produce a better quality care. The patient is gonna benefit on the outcomes and on the results. The patient's family, the whole community, the whole ecosystem. So we are producing a systemic change. Everyone is gonna benefit in a positive way. And this is what we need in this world right now, when there is so much bad news and stress
and negativity
and conflicts happening. We need to be the changers, okay? And we need to be the change that we want to see in the world. It's not waiting for someone else.
It starts from every human being.
It's
exactly. And another thing that I think the institutions will benefit because when the staff is happy, they reflect their happiness to the clients or in our case, like the patients. They give more. They are more welcoming. They are more helpful, and they give from their hearts. And the patients feel it. The patients, they know how they are treated, and they will prefer this, for example, clinic over this or this another clinic. So I think this is very important. Part of the what do you call it also? Like patient experience.
Yeah, the
we call it the
strategy,
patient
right?
experience. So when there are happy people in the place, you want to go again to this place, and you choose it above other places.
Happiness is contagious.
Yes.
Positivity
Yes.
is contagious.
Yes.
So we can just see the positivity spreading everywhere.
Exactly. And what is more important than healthcare institutions? Because we, as we said, we are touching lives. So when we are touching lives, we need to be very well physically and mentally. While it is in this life like very easy to tell people to take care of their physical health. For example, they tell you go to the gym, eat healthy diet, sleep well. However, no one tells the people how to take care of their mental health. So by definition for me, and I want to listen to your opinion also, mental health is to be happy. I mean, why we are in this life, why we are working, why we are achieving, why we are dreaming, in order to be happy. So being happy is required. So what are the steps that healthcare professionals can start with? I know it's in your program, in your framework, but at least the knowledge. You spoke about the knowledge. Tell us more. What the healthcare professionals should know, the basics for them to be happy.
This is another great question. And I think happiness is a byproduct of what we do in life. So knowing our purpose, like in healthcare professionals, it could be our purpose that we went into this profession to produce a positive change in our ecosystem.
Yes.
So to understand your why. Why are you here? Why are you in this organization? Why are you a nurse or a doctor? Knowing your purpose is very important, because a lot of stress and dissatisfaction can happen when individuals come to work in organizations and then they don't know their purpose, they don't know their why.
Yeah.
So it's not really organizations' fault that people are sometimes in wrong jobs,
True.
in wrong roles, or not exercising their real talents.
Yes.
So what is really my strength? Am I really producing a maximum output in the role that I am currently in? So to know yourself first, why you came to this role, why you came to this planet, what is your
why
purpose?
you chose this profession.
Why you chose this
I think in interviews for medical schools or nursing schools, this should be one of the most important questions to be asked.
Interviews, I would say. When we are interviewing people for positions, what is your purpose?
What's your purpose? Yeah, very nice. And after that, like they are in the job, they know their purpose, they like it, but with the busy life, with the busy shifts at work, what do they have to realize about themselves? How to manage their stress, at least in the basic level?
One of the most powerful awareness that I was able to deliver to the senior nurses was that stress is a naturally occurring phenomenon. So when we see in social media adverts like stress-free life, it does not exist. So when we start fighting it, that I don't want stress, I don't want to, run in this cycle, this is the wrong, I would say, intervention. We need to accept that stress is a part of life. Sometimes it's barely visible, sometimes the level is really high. But do I have the right set of skills to navigate it? So here comes the mental agility and emotional intelligence. How do I navigate the daily stressors effectively and graciously?
Yes.
To thrive, not only to survive, right? Not to be on this hamster wheel and run continuously.
Survival mode, we don't want.
Survival mode. I'm stressed, I'm busy.
We want to live and enjoy every single day of our life, of course. So when you go to the healthcare teams, you usually go through the hospital managements or the clinic managers, and you agree. You have an agreement with them to train the staff. So tell us about the experiences so far. Some positive impacts you've done with certain teams. Any successful story, if we can say?
I have done a lot of workshops recently about resilience in healthcare, how to bring more resilience into healthcare. And majority, I would say all of these sessions, the result was for me even overwhelming. I did not expect that people were going to engage on such level. It was almost like they are waiting for the opportunity to say, this is me. I am really stressed. I am really overwhelmed and I don't know what to do. And this is like a recurrent theme in there. They just want someone to listen to them and then brainstorm through solutions. So even if I deliver, let's say, a workshop 2 or 3 hours, we are able to already produce some results. People come to realization that we are all facing similar challenges. We can find solutions on a collective level. It's very difficult to find solutions by yourself, and we know that burnout is linked to loneliness epidemic in the workplace. So imagine that lonely individual who is suffering, not asking for help, is very unlikely to find solutions by themselves.
True.
But when people come together collectively and start supporting each other, they're going through the same narratives, then all of a sudden the healing happens in the collective space.
Yes.
And very often they don't need therapy, they don't need interventions, it's just someone to listen to them, give them space to express themselves and try to find the solutions. Sometimes they have the solution, sometimes I need to bring further training just to make them aware what else is available to them.
Yes. How long usually an effective learning course or mental health coaching course?
It really depends, but if we are talking about healthcare organizations, this should be embedded in the organizational strategy. If we want to be the organization that is really claiming that I am supporting my employees, I am looking after their mental health, then there has to be a structured program. Yes. There has to be a support network so people know whom to go to when I am stressed or I am burnout. People trained in a specific topics. So
I think the whole world is going in this direction now.
Yes.
It's not a choice. Mental health is as important as physical health, and they are both complement each other. So also in healthcare, because there are teams. We were discussing outside also that sometimes the stress is induced by the team leader, for example. Whether the team leader can be a doctor, can be a nurse, can be the head of certain department, anything. So when you do the courses together, first of all, so the connection between each other gets better, and they will deal with each other more on a humanitarian level, right? They will see each other as humans, not only as employees working. Yes.
So when I work with teams, specifically applying team transformation interventions, I start with the team leader to check the awareness, how they are perceiving themselves before they start giving me the assessments of specific members of the team. And the beauty of systemic coaching or team transformation coaching is that we start with the I, then we move to we, and then we move to it. And it is the collective intelligence. Okay. People realize that as an individual, their impact is limited. But when we come together as the collective intelligence, all of a sudden, we start seeing each other as a human. We start producing better results. We are more engaged. Everyone is benefiting. Because the ultimate result of the team transformation coaching is the person outside that room that is going to benefit, the stakeholder that is not directly here involved in this conversation.
Very true. But this is really great what you are doing, because I think even us as sometimes we are leading a department or head of the department, you ask your team, how are you doing? But in reality, maybe we should go deeper, how are you feeling today? Are you happy? Did you sleep well? Maybe all these questions we should ask our people about our teams to know their human part, how they are doing, not only just a simple question we are used to ask every morning. I think it's beneficial to all of us to have some coaching from people like you in the mental agility frameworks you are doing. So Magda, what's your final word to our audience, to our listeners? What do you want to tell them? Final message?
Actually, when you just ask me, should we ask these questions, right? How are you really doing? There is a powerful greeting in South African language when instead of asking how are you, they say sawubona, which means I see you.
Oh, wow.
I see you as a human. And very often
Yes.
in our organizations, when you see how are you, and you don't even wait for this patient, for this person to give you an answer. How about if you just tell them, I see you, and wait then for the response?
Oh, very nice. Great. Yes. Thank you very much, Magda Snowden, for all what you are doing with the healthcare professionals and through them to the whole society. Thank you very much, and keep this great work, and looking forward to hear more and more about you. You've recently nominated or a finalist in certain award, if you like to.
Thank you, Dr. Wafaa, for this opportunity, because I love to raise awareness about this topic. And yes, I am one of the finalists for the Mental Awards 2024 in the category of Mental Health Champion. So it is a huge recognition. And
Yes. Congratulations.
Thank
and
you
well
so
deserved.
much.
And they can also find you on LinkedIn.
LinkedIn and Instagram, yes.
And Instagram. Okay. Thank you very much, Magda
Thank you.
Snowden.
Pleasure.
Thank you.
My pleasure. Thank you.